This video is going to go through a post-operative meniscus tear repair rehab protocol. Now, it's important to remember that protocols aren't an absolute, they're more of a guide, and patients will vary in their timescales following any type of surgery. The first stages are just going to be about protecting repair, getting the pain under control, following some brace and weight-bearing instructions as guided by the surgeon. Trying to get that swelling under control as well with some elevation. Ankle pumps are generally advised as well to keep everything moving in the lower limb as much as possible. When tolerated, some assisted knee flexion. Usually the first milestone is 90 degrees of knee flexion. We don't like to move past 90 degrees of knee flexion in these early stages, but having a towel wrapped around the foot and assisting that knee flexion will be a little bit easier than trying to actively flex the knee in the early stages. It's important to start some form of quadricep setting where you've got a nice big bolster underneath the knee and you're trying to actively straighten that knee, and it might only be partial, as you can see here. I'm not getting full extension of the knee, but essentially aim is to get it fully extended, nice and straight, and as time goes on, that bolster underneath the knee can get a little bit smaller. Ability to hold that knee in full extension can be held for a bit longer. Now the next stage after that is trying to lift up the knee in full extension with no lag, which essentially means a bend in the knee as you lift the leg up into the air. If we're looking to do a bit of a prolonged stretch or do some quadricep sets with a towel, it can be bolstered underneath the heel to make it a little bit more provocative, but it usually might take a few weeks to get to this stage. It's important to do some patellar mobilization, keep everything moving nicely and freely, as shown here. Criteria for progression, or just some general goals to hit in this first stage, is to try and get that knee flexed towards 90 degrees, getting knee extension to 0 degrees, so essentially just a straight knee as much as possible, and the ability to do a straight leg raise without any knee bend. In terms of sets and reps and frequency, it's really difficult to say there's a definite amount that patients should be doing. I tend to recommend, at least as a baseline, twice a day, using a general rule of thumb of anywhere between 10 to 15 repetitions per exercise. If things like time isn't an issue and patients can tolerate it, they might do it a few more times than twice a day, but it really will be dictated on the situation and every patient will be different.